everyone, welcome to another Power Talk with Archana. Power Talk in Archana presents to you Power Health in collaboration with Fortis Healthcare. Yesterday, the Fortis specialist Dr. Shankar discussed with us about the lifeline of our body, our heart. In this second episode of Power Health in collaboration with Fortis, we will be talking about our bones and everything that can save us from joint pains. Dr. Harshavardhan Hegde is the Executive Director, Orthopedics, Bone and Joint Surgery at Fortis Escorts Health Institute, Delhi. With his expertise in spinal surgery and joint arthroplasty, he is the first doctor in the country to do robotic spinal surgery in 2013. Let's welcome Dr. Harshavardhan Hegde here. Good noon, doctor. How are you doing?
Very well, thank you. It's a pleasure to talk to you, Archana.
Thank you, sir. Pleasure is ours, sir. So as we start this journey, we would like you to please help us with 5 things we can do to boost bone health.
Well, the 5 things that anyone can do to keep his or her bone health good, people should exercise. Whether this is in the form of regular walks, cycling, swimming, going to the gym, and avoiding exercises and taking medication to keep the bone health good is not going to work out. So it is always necessary that people combine exercises with the medication that is given in terms of calcium, vitamin D, B complex, and others. Otherwise, it doesn't help the bone to recover and the bone to remain healthy. The second thing, having a healthy, wholesome diet. Now, whether one is vegetarian or non-vegetarian, it is necessary that one has adequate amount of calcium, one has adequate amount of vitamin D, other vitamins in the diet. In the event there is deficiency, then you need artificial supplements, which will help to boost. But these artificial supplements should not be for life. And in some cases, one may need to take the help of a nutritionist because all of us have different tastes, all of us have different absorption abilities, and it is difficult one system working for all. So they'll have to be tailor-made for each individual. The third thing I would think is exposure to sunlight. So exposure to sunlight, most people misunderstand in the form of just lying in the sun or sitting in the sun. That's not good enough. One would have to walk, cycle, swim, jog, run, whatever one likes, for at least 10 to 15 minutes every day, with about 15 to 20% of the body surface area exposed to the sun, without any cream that is put. If one puts cream, then the ultraviolet rays are unable to reach beyond the skin and convert the inactive form of vitamin D to the active form. It is important not to get into habits like smoking. Smoking has a very deleterious effect on bone quality, and it can lead to osteoporosis, also lead to osteoarthritic changes, which will then hamper the quality of the bone as time goes on. It is important that one controls certain diseases like diabetes. Diabetes reflects poorly on the bone, uncontrolled diabetes, that is. So it is important to get diabetes well under control. And once you take care of these kind of illnesses, which are manageable, then you see the quality of the bone improving. And if you have good quality bone, it does not deteriorate.
As you very rightly said, all said and done, if we do see a decrease in the density of the bones, more so around 40-45 years of age, with increasing pains in joints of the body. What are your thoughts there?
It's a very interesting question. Bone density develops, improves, and increases and becomes very good by the age of 30. After the age of 30, we as human beings can only maintain it. We cannot improve it from the level of age 30. So it's very important that we
have we do regular exercises at a younger age. It is important to emphasize this with children. And this physical aspect of our lives, if we neglect between the ages of 20 and 30, they tend not to exercise and also not very cautious with their diet. So this leads to a bone density that is slightly low at the age of 30. After the age of 30, bone density by the very nature starts reducing, especially in people who do not exercise, do not have good diet, tend to smoke, or do not control illnesses like diabetes.
If we start with a good bone density at the age of 30, we will end up with a decent bone density by the age of 70. If we start with a poor bone density at the age of 30, we are bound to end up with a very osteoporotic bone density at the age of 70. So it's important that we put this emphasis.
Doctor, tell me one thing. Does the gender also play a role in bone health?
See, there are reasons why gender plays a role. One of the major effects on our body is the role of hormones. Now, in women, there is when menarche comes in, that is, the hormones start becoming affected. What hormone? Estrogen comes in, and a child starts having her period. That's the time when the hormones kick in. And at during menopause, it suddenly goes down. Now, hormones like estrogen and testosterone in males play a very positive role in maintaining good bone health. Now, what happens as we get older in women is that once premenopause and menopause sets in, the hormonal level doesn't go down gradually like it does in men. It goes rather precipitously. Suddenly, in a matter of 3-4 years, a lady who is having good estrogen level has rather low estrogen level, and she stops having her period, etc. So this leads to many changes in the body, like mood changes, etc. Now, exercises brings about a similar effect as estrogen does. So if you see a person who's been an athlete or a regular exercising person with a good diet, you will see that they pass through the physical discomforts of menopause much better. Whereas people who do not exercise have more bone pains, joint pains, lethargy, etc. developing after menopause or premenopausal and menopausal time. So it's important that exercise continue, and it plays a vital role. Now, this kind of hormonal changes are not seen in men. There is a testosterone level, and then after the age of, say, 55, 60, the testosterone level starts going down slowly, gradually. So it's easier for a male to cope with these hormonal changes, whereas it is more sudden with a lady. And these sudden changes are something that can be mitigated in the area of physical. I'm not talking the area of mental changes that occur because of menopause, etc. But in the physical, in case of bones, muscles, and joints, ligaments, and tendons, by regular exercises. So I can't emphasize exercise being central.
Thank you so much, Doctor. It has really been a very, very enlightening conversation with you. We really wish you all the best, and thank you so much for your valuable time.
Thank you, Archana. Thank you for giving me this opportunity. Thank you very much. Have a good day.
Thank you. Bye-bye.